Hey guys, you are watching my psychology channel. So I'm Gary. So today it's our pleasure to have Farah here for a very short interview. So before that, Farah, would you like to introduce yourself to our audience?
Sure. So my name is Farah Gulamoidin and I'm a clinical psychology graduate. I graduated from here in Malaysia, currently residing and working in Perth, Australia, and I'm a registered psychologist there. And I think the reason you're interviewing me today is because I have been bringing acceptance and commitment therapy, also known as ACT, to Malaysia. I've been training mental health professionals in this approach.
So I have one question is, many of us, I would say most of us always hope that we can feel good, we love to feel happier in our life.
Yep.
So, in common sense that we don't like to feel sad, we don't like unpleasant emotion in our life. Mm-hmm. But somehow, it's unavoidable. We feel sad, we feel disappointed towards some events in our life. Mm-hmm. So how can we cope with that unpleasant emotion as well? How can we cope for a better life?
That's a very interesting question. From an ACT approach, we aren't so much about coping with those bad feelings or trying to get rid of them. We are about fostering acceptance. So usually these bad emotions are a sign of something that is important to you. For example, if you feel sad that someone you love has died, that probably tells you that you probably love this person a lot. If you didn't love this person, you're probably not going to feel sad. Is that correct? But we can't get rid of the sad feeling, because if you got rid of feelings altogether, we might also get rid of the feeling to love. We get rid of the good, positive feelings as well. Does that make sense? Mm-hmm. So acceptance is about teaching us or telling us about fostering willingness to experience these negative emotions, so-called, because it is part and parcel of life. However, if negative emotions become a barrier to things we want to do, now that is where most of us see it as a problem. Acceptance says, can I do things that matter to me, things that are still important to me, such as going to work or going to school, and still, in spite of having those feelings. So I can't wait for those feelings to go away before I do things that are important to me. If I wait, it's probably not going to happen. But if I go ahead and do something, despite those feelings being there, what kind of life would that look like? And if you just think of, your own experience, when have you felt really nervous or really afraid when you had to do something, yet you still went ahead and do it? Can you think of any examples?
Maybe attending a job interview.
Yeah.
That I feel very nervous and afraid.
Yep.
Worry as well.
That's a great example. And if you felt all that fear and nervousness and let that control you and dictate to you what you should be doing, would you be attending the job interview?
No, I think I will just keep avoiding.
Keep avoiding. If we keep avoiding job interviews, what happens?
I will end up unemployed.
Unemployed, yeah. So not a very productive life, and realistically, we all need money to survive, right? So we need to be working. So a lot of us can relate to the experience where, we have had that negative emotion, right? But we still went ahead and do what's important to us. And when you go ahead and do it anyway, what happens to that feeling? So during the job interview and you just went ahead and do it, where do those feelings go?
I would say it won't go off. Sometimes it still comes.
Yep.
But
as you progress,
it doesn't stop me from attending interview.
Yep. And the more we progress with the interview, those feelings just kind of
subside.
Yeah.
Sometimes.
Yeah. So that's how we want to treat or change our relationship with negative or unhelpful emotions.
So thank you so much for sharing with us, and I hope you enjoyed this interview. So check out for more workshops or talks from Farah, and we will update in our social media as well. And also like and follow My Psychology for more content, psychological contents, videos or workshop info from mental health professionals. Okay?
Cool.
Thank you so much.
Thank you for having me.